Hi, everyone. It's Dr. Alfie here with the next episode in our series on loving someone with fill in the blank, but make it self care. This week, the fill in the blank is depression. And in particular, it's depression that's an extension, downstream extension of being traumatized. So, quick story, and then we'll talk briefly about ways that you might manage if you have or find yourself in a similar situation. So, there's a family I'm aware of where a parent was injured on the job and subsequently had to leave their job, which they really loved, due to the injuries sustained on the job. These were physical injuries. Well, what a lot of people don't realize is that when you sustain physical injuries in some way, sometimes that can lead to emotional stressors. And if those emotional stressors go unchecked, that can lead to more significant impacts like psychological distress, and then beyond psychological distress, some form or fashion mental illness. And so in this family's case, there's a parent, the parent had a spouse, they had multiple children, and it's a family of color, all of which is important. What ended up happening was that the parent would go through these cycles, and the cycle really sort of manifested itself as periodically, maybe once every 5 or 6 weeks, the parent would get really down, would literally go crawl in the bed, pull the covers up over their head, and just would be very difficult to engage. Not so angry, but just withdrawn and very sad and tearful. But when questioned, would always say, I'm okay, I just need to deal with this thing. But the thing that they were dealing with was never about the traumatic experience of the injury and the subsequent difficulty in obtaining workers' compensation or compensation from their employer, because the employer didn't want to pay them and wanted to behave as if it wasn't their fault, even though the injury was sustained on the job and was a direct result of the organization failing this employee, this parent. So the family has older teenagers, and I'll tell you what the older teenagers were struggling with. They have a parent. They remember their parent being one way, and then there's this point in time where this injury happens, and then the subsequent court battle, and now their parent is a different way. And they didn't know what to do. On top of that, as we know, in many families that are of marginalized backgrounds or of color, you already know what I'm going to say. We are not sometimes willing to acknowledge that what that loved one is struggling with might be a mental health concern, might be actual psychological distress that warrants clinical care, might be a mental illness. So this is what this family struggled with. So let's talk about how to support those children and how to support that family unit. If you found yourself in that situation, I think there are a couple things you can do. One is to look at the situation and then go to dig up information. You can find some information on my website at dralfie.com. You can find information on my Instagram page. You can find information loads of other places, just to give you a sense of what happens when someone is traumatized, and then what are some of the potential downstream effects of trauma. In this case, this person clearly met criteria for what we would call a major depressive disorder. It's understanding that that person might be dealing with and struggling with depression, not acknowledging it and not getting help for it. So as the spouse or the partner, that's my job. My job is to recognize that that's what my partner is dealing with. That's first. And I have to come to terms with that. Next, it is to have a conversation with my partner in a manner that that person can be receptive to help them think through or begin to consider that they're struggling with something. Right? So it's not enough to just tell the kids, no, I'm fine. It's just, I get like this sometimes, it's just cyclical. No, it's not. If it goes on long enough, it's no longer just cyclical. It's a problem that needs to be addressed. So it's trying to engage that partner, that loved one, to help them understand something's going on, right? I don't know what it is. Maybe you don't either, but let's try to figure it out together, and reassuring them that you're there and available to try to help them. The next thing is you got to talk to the kids. You have to talk to the rest of the family, right? And you have to figure out what's the best way between the two of you as partners to do that. Is that partner ready for you to disclose to the children that he or she or they might be struggling with a mental illness? Are you ready to disclose that to the children? Are the children developmentally in a place where they can understand it? Right. And so once you identify all the facets of the conversation that you need to have, are you ready for the conversation? Do you know what to say to the children? Is the loved one who's struggling with the mental illness ready for you to disclose? If not, why? If so, how are you going to do it? Then the next step is to have a conversation with the children and to help them understand and come to terms with what that parent might be struggling with as a downstream effect of being traumatized. So again, it's a number of steps, but it's being very thoughtful about how you center yourself first, get grounded first, get the knowledge first for yourself, then talking with that loved one to see where they are in terms of their willingness to accept what they're dealing with, then bringing in the extended family in a way that feels comfortable for you and that partner. Not saying that it necessarily always goes that smoothly, but those are the facets of the experience I think you want to be mindful of. And that, being mindful of all those pieces, is one of the most important ways you can practice self-care. So I hope this helped you. I know this series is a little longer. In part, it has to be because there are many aspects of this and these kinds of conversations that we want to make sure we cover. And as always, I want you to drop me a line in the comments and tell me what other topics you think we should be discussing in this series on loving someone with X. Remember, today we're talking about depression that's a downstream effect of having been exposed to trauma, but make it self-care. So as always, until next time, I will wish you lots of love, lots of light, and I'm hoping it's always informed by good, culturally relevant science. Take care.